It's a beautiful day in the park. This is Riverside Park in New York City. So I decided to come out here and ask people, are you in pain or do you know anyone who is in pain? Everyone said, yes, I'm in pain or I know someone who is in pain. With so many people in pain, the question is, what kind of pain? Well, we had everything. We had migraines and we had lower back pain, joint pain, arthritis. We have all kinds of pain. I'm Gary Null. Here's the good news. For not only you, but anyone else who wants this information, we have a natural, non-toxic way that we can prevent pain and reverse it. We will show you some of the world's leading physicians and medical doctors, pain experts, who will show you what actually causes inflammation, because it's inflammation that causes the pain in most cases. And then how do we turn off that inflammation? So my challenge was, can we actually prove in a large group of people that we can reverse pain? Here's what we did. We brought in a group of people who had chronic arthritis, some for as long as 25 years, all on different medications, and over a period of 4 weeks, that's 4 weeks, 1 month, we were able to substantially improve their pain or reverse it completely. So we have all these great doctors, we have all these people's experience, we have a clinical study, and now it's for you to watch all this and see if we can help you eliminate pain in your life. Join me now as we begin our journey of health and healing.
I have very, very bad arthritis in my knees. I've had double knee surgery in the mid-90s, and it's gotten progressively worse.
Since I broke my wrist 6 years ago, I've had arthritis in my wrist and my thumb.
I've had neurospinal surgery, a laminectomy and a microdiscectomy. I still have pain.
Chronic pain takes a terrible toll. This abnormal amplification of pain that so many pain patients have, it makes people sad. It makes people hopeless. It makes them very anxious, because if you're a chronic pain sufferer, you don't know what's going to happen tomorrow. You don't know if you try to go down to the grocery store if you're going to pay for it. You don't know if you try to climb those stairs more than once, are you going to end up in bed? So chronic pain patients live in fear of the pain getting worse.
Arthritis is a multifactorial disorder. It affects a great segment of the population, a huge segment. Over 50 million people have some form of joint disorder.
Arthritis, if you break down the word arth, is from joint, and itis is inflammation. So it's inflammation of the joint. And the two most common types of arthritis are, one, osteoarthritis, which is the largest type of arthritis that almost everyone's going to get. It's really the effects of aging. Then there's rheumatoid arthritis, which is an arthritis that has to do with the body attacking itself. It's called an autoimmune disease. And thank God it only affects a smaller number of patients than osteoarthritis, which is really going to get much greater as the boomers that are starting to enter into the older age group now, they're going to present a real challenge to the medical care establishment.
More broadly, it's changes in the joints, both anatomically and functionally. And that just means that the joint is not entirely normal.
As we get older, there's wear and tear on the joint, and the joint has a bunch of different parts. So it has the lining of the joint, it has the bone, and all of these parts can become degenerated, and they can all be associated with the production of pain.
Over time, from repetitive activity, you start to put wear and tear on your ligaments and tendons, and they can start to make the joint hurt. And then the cartilage becomes worn because the joint has become loosened by lax ligament or tendons, or the disc in the back becomes weak, or you degenerate or grind down or even herniate that because of the looseness of the ligaments and tendons over time.
You can also have what's called a gouty arthritis, where you have crystals that are caused by gout. And you can also have psoriatic arthritis, which is when people can have psoriasis and they also can get joint pain and inflammation.
There are people that have infectious causes of arthritis, bacteria, virus, parasite, Lyme disease. So that's a whole category in and unto itself. There may not be bone damage, there may not be ligament, tendon damage, but the organism is causing inflammation and that's causing pain.
And what's inflammation? Inflammation really is caused by the white blood cells and different hormones called cytokines and macrophages and the like that go to an area in the joint space and in the joint to cause pain and swelling.
An accumulation of water, accumulation of red blood cells, white blood cells, and the whole process of inflammation at the microscopic level in the joint.
We have muscles that surround this joint. So when this joint starts to function in a problematic way, the muscles can either tighten up, go into spasm, or they can actually become weaker. That pain in a joint causes the surrounding muscles sometimes to not be able to do full contraction.
Not all of the pain comes from tissue damage or something dreadfully wrong in the part that hurts. The nervous system has an intrinsic ability to exaggerate pain signals.
Pain starts in the periphery and then goes up into the spinal cord. When you have pain, something very interesting happens. If the pain persists even a very short period of time, it changes the physiology in the cell. We call that sensitization.
The pathways get sensitized. And so I see someone who may have torn a rotator cuff, we rehab that shoulder, the rotator cuff heals, but she still has pain. Because the pain went on, it was long lasting, the pain actually takes on a life of its own in the body.
Once you sensitize that cell has connections to other cells at other levels in the spinal cord. And these are ineffective channels. They're silent. They're not open. Like a highway that is built, but nobody travels on it. But when you sensitize the cell, the highway opens up. So I can start to feel pain in another part of my body that has no damage whatsoever. And that's called referred pain. And if that pain is there long enough, it can make me want to stiffen up in that area because that's a natural response in the body. So if we then tighten up in that area long enough, we can actually cause damage in that area now, so that not only is it referred, but now that area itself becomes a source of pain, and that can spread to another spot.
They're the inflammatory arthritises and the osteoarthritis, which is generally non-inflammatory. So you have rather different causes between these two different forms. The inflammatory arthritises are caused by a distortion of the immune system. When the immune system starts to attack your own tissues, your own connective tissues, your own joints, the structural tissue around the joints get attacked by the immune system.
Your body is being triggered into making antibodies to attack its own tissue. So that's, fortunately, a smaller percent of arthritic conditions.
That is a not so common but a difficult condition that needs to be treated from the immunological point of view.
Typically, it's not an issue with the joint itself, it's an issue somewhere else in the body because the immune system makes the inflammation. And then for whatever reason, genetically, people are predisposed to have that inflammation duke it out in the joints. I find that since most of the immune system, about 70 to 80% of it resides in your digestive tract, I believe a lot of the things that go on in the digestive tract really drive a lot of that inflammation that ends up in the joints.
The routine arthritis that everybody gets, you know, there isn't really anyone over the age of 40 who isn't going to show some arthritic changes on an x-ray. And that's just wear and tear. Now, the important thing to understand with wear and tear is the more wear and tear you have, the worse. Football players get really bad degenerative arthritis. If you've had trauma, if you've had repeated injury or impact to the joints, that will predispose you to getting this degenerative osteoarthritis a little earlier than somebody else would.
I wish I could say there was just one singular cause for arthritis, but it could be any combination of factors. One of the factors is allergies, environmental allergies, food allergies. It creates an inflammatory reaction in the body. A large part of arthritic pain comes from toxins that are deposited in our joints, and a lot of our toxins come from our diet.
If we don't pay attention to our weight, that is the most damaging thing that we can do to our joints. So aside from getting older, if you are very obese, your chances of arthritis go up geometrically.
I really feel that most illness starts in the mind and in the brain with stress. Because when you have stress, your body and your cells do not function optimally, and your immune system is affected immediately, especially when you get chronic stress.
The excessive amount of stress that we're all affected by on a daily basis, morning, afternoon, and night, is detrimental for the health. Why? Because it does affect, one way or another, the adrenal gland. As the adrenal gland is affected, as a reaction, it shoots cortisol. And when that happens, those little things that are inside of the cells, called mitochondria, because they are being pushed to overwork, they start sparkling. It's like they start throwing sparks to the outside, which we call free radicals. And those free radicals, again, caused by the cortisol, caused by stress, those free radicals are damaging to the cells of the cartilage, and they interfere with the healing of the joint.
Emotions are clearly related to all our health issues, including arthritis. There's very substantial research about rheumatoid arthritis typically coming on after a major stressor in a high percentage of people who have that condition. When your emotions are in flux and there's a lot of negativity and a lot of fear, our body goes into survival mode and fight mode. And fight mode includes being able to inflame very easily, because if you're fighting and a bear is coming at you and is swiping at you and cutting you, you need to be able to create inflammation to fight infection. And so we naturally create a lot of inflammation when our stress hormones are up.
My approach to all patients that come in is a comprehensive medical nutritional evaluation, where for every patient we're testing vitamins, minerals, hormone levels, absorption, digestion, immune response, 50 cardiovascular risk factors, so it's very, very thorough. It's about a 12 to 14-page test. Within that, we certainly do look for autoimmune phenomena to see if there's an autoimmune component to an arthritis. We'll look at markers of inflammation, sedimentation rates, C-reactive protein. We're looking at viruses, bacteria, infectious agents, so we can determine if infection is contributing to arthritis.
I want to make sure that their chemistry is normal, they don't have liver disease, they don't have kidney disease. I want to make sure they don't have diabetes. Diabetes damages the nerves, can cause burning pain.
When I think about osteoarthritis, what I like to look at is what's the cause of the degeneration. So for example, the osteoarthritis of the knee, the first place I like to look is the foot, because the foot is really, when it's well supported and well aligned, then usually the knee stays well aligned. If the knee stays well aligned, then there tends to be a lot less degeneration.
Most chronic pain patients who've had many therapeutic trials that have failed them, many treatments that have failed them, they usually come in on a lot of the wrong medicines. And generally, I try to trim that list down. I had a patient come in on 6 different forms of opiates. I got her down to 1 long-acting compound and 1 short-acting compound, which is the standard of care in pain medicine, and she started doing much better.
How do you make the diagnosis? If I say, it hurts in my knee, do I have arthritis? The amount of destruction you see on the x-ray doesn't tell you how much pain you're going to have. So you can have somebody with a tiny amount of destruction, a huge amount of pain, and somebody who has a large amount of destruction and no pain whatsoever.
The vast majority of people who have what looks like arthritis on x-rays have no pain at all. And also people with arthritis, you can get them to be asymptomatic, to be pain-free. And so arthritis doesn't always imply that you're suffering with pain. What it does mean is that there are changes in the joints that can be seen on x-ray, on physical exam, and in terms of the function of that joint. And we focus particularly on the function.
When we assess pain, it's not enough to look at pain intensity. One must look at how the pain interferes with the ability to function. So you want to combine two things. One is, do we see changes on the x-ray? And two, the patient's report of impairment related to pain in a joint.
We need to understand that pain lives in a three-coordinate system. There's the physical pain, there's depression, and there's anxiety.
One of the problems with patients coming through the door to see their primary care doctor is that 50% of the time their depression is missed. And one of the major reasons for people going to see their primary care doctor is because they're anxious or depressed. But if I haven't asked them about their depression, I'll never know. And if it's not a high index of suspicion, I'll never know. If all of us who are treating patients in pain don't keep that in mind, we're not going to get optimal results.
We have to look for psychiatric conditions, depression, anxiety, phobias, thought disorders, abuse, obsessive compulsive. We have to look for these conditions and try to nurture that patient into better care for those conditions.
There are so many people out there who have the psychological roadblock. Once they start to have a symptom or a pain or a dysfunction or disability, they get caught in it and they can't step out of the box, can't think beyond it. You've got to make your mind want to look for ways to improve. And as you take little baby steps and you do a little bit better and better, then all of a sudden those steps are becoming larger and larger. You don't realize it. You're half the way there to becoming more whole in your thought process.
When you can't make the assumption that the person who sits in their couch eating potato chips all day long is the same as the person who's in the gym 3 to 4 times a week. They're not. And their problems may be totally different, even though they're both complaining of back pain. So the assessment of the individual is most important. After that, to categorize them as to what they lack and what they need, and then to figure out, to going forward, what you can do to prevent recurrence of the incident.
Prolotherapy I've used for many years, and that involves using nutrients, B12, glucosamine, D-ribose, saline, dextrose, calcium, to stimulate blood flow into the tissues, and that's been around for almost 100 years. It's a wonderful, safe treatment, always works. The newer technology now is to use autologous treatments, means coming from your own body, where we can take your blood, spin it, separate your platelets that are filled with growth factors, get them in a concentrated form, and inject the platelet right into the ligament or tendon. So that creates an amazing healing response. The third is stem cell therapy. That's where we can take your bone marrow from the hip, and we do it in a painless fashion, and pull that liquid out, put it into a centrifuge, and now we have stem cells to inject into tissue, which is the ultimate way to grow and repair a damaged tissue.
You want to go to a physical therapist, number one, who spends time with you, not someone who puts you in a cubicle, attaches you to a machine, and leaves. If you find somebody who's there with you, hands-on, who really gets to know your body and finds out what you need specifically for your pain and dysfunction. Are you weak? Then strengthening. But if you're strong, you need perhaps limbering and stretching. If you're tense, you may need relaxing. And a sensitive physical therapist can really tune in to all the various reasons that you're having problems in functioning. Thoughtful treatment is more important than, the type of physical therapy.
We have hundreds of papers now in the last 10 years that demonstrate the benefits of therapeutic massage. Even papers most recently that show improvement in your blood chemistries. It actually changes your brain chemistry, it improves your immune system, it balances your hormones, and it strengthens the defense cells. And this has been shown in really rigorous research.
I find it's very important to do things that allow a person to open their back up and open their spine up. You know, what the technical term would be traction, where it kind of opens. Sometimes it's appropriate to manipulate it like a chiropractor would or an osteopathic physician might. But more oftentimes I like to do it very gently and have people do things like yoga, back exercises, sometimes inversion tables I think are wonderful to open it up because we got to bring blood back to the area. You know, joints in general don't get a lot of circulation. The way the body's made, there's not a whole lot of circulation that goes to them. So only opening it up and bringing movement is useful. Also, as a naturopathic doctor, I love using contrast hydrotherapy, having people do hot and cold treatments and movement, because hot and cold treatments, when you do hot, it brings blood and circulation to the area, and when you do cold, it vasoconstricts the vessels and it takes the circulation away. So you kind of create this pumping effect. If you have them doing repeating hot and cold, you're getting new blood in, getting the old blood out, and it helps the repair process.
We have basically two models. We have the Asian Chinese model, and we have the Western model. And they aren't at odds with each other, they're just different. This is explained in terms of neurotransmitters and pathways and, you know, Western science. This is explained in terms of energetics, the idea of there being this body energy, or qi, that travels through channels, that animates our tissues, that heals us. Now we have a fair amount of research that shows that acupuncture can be quite helpful for a number of pain conditions and for arthritis.
I really enjoy using acupuncture, especially for more difficult cases, because I think it's a good way to get in there and kind of bring the energy back to it and start moving the energy in that area. The most well-known point for pain in Chinese medicine is a point called large intestine 4, which is right near the thumb, sort of like a little mountain there, and you go to the top of the mountain, and it's basically right in between in that webbing there. And you just press gently, and I tell people to hold it there for a few seconds, take a few deep breaths, you know, try to bring the energy into the body and calm it, let go, and then in a couple seconds press again, and do it a few times. And you can do it throughout the day as well.
The beautiful, gentle Chinese metaphors for how acupuncture works. That is the yin to the Western yang, the hard science, the biochemistry, the neurophysiology. I see these explanations as both being balancing. What we do know is that when you put an acupuncture needle into somebody's limb, you do stimulate the release of morphine-like compounds in the brain and in the fluid that surrounds the brain, the cerebral spinal fluid. It has also absolutely been shown that acupuncture blocks the pain transmission coming up to the brain from the body that hurts. In the spinal cord, there are these gates that the pain has to go through. And we know that acupuncture does tend to close these pain gates, letting less of the pain come up to the brain.
The first thing I think about even before food is water. If people aren't hydrated and they're not drinking water, I mean, think about joint tissue and cartilage. It's made mostly of water. Most people are severely dehydrated in this country. Without that water, without that environment that's just well hydrated so that the body can move things in and move things out, it's not going to repair anything. It's not going to bring the circulation anywhere. So even before I think about foods, if people aren't well hydrated, the first thing I'll tell my patient is we need to start drinking water.
When you hydrate the body, you're helping the body to release toxins, and you can eliminate them through the urine.
For those individuals that have arthritis, we need to talk about diet and what you need to do at home to keep yourself in a healing mode or to be on an anti-inflammation, type diet.
When you eat fast absorbing sugars like glucose and fructose, high fructose corn syrup, or you eat a big chunk of white bread or anything that's milled, any grain that's milled, that gets converted into sugar very quickly. It has what we call a high glycemic index. And if you eat a lot of it, it's got a high glycemic load. It loads your body with glucose very quickly. But what most people don't know is that loading the bloodstream with these simple sugars from starches and from sugar itself creates these very inflammatory compounds. This is really bad for people with arthritis.
You get the production of what's called AGES products, AGES, advanced glycosylation end products, which deposit in different areas of our body. So sugar is so inflammatory.
You have to have consciousness about what you're eating. We can prevent the destruction of our chromosomes by restricting our calories. And there was just a 17-year study done with monkeys. And you look at the monkeys who had 25% less calories than their cohort, who had their usual amount, and the usual amount of food in the cohort group had gray monkeys who were a little bit demented and had a lot of arthritis and a significant amount of diabetes, and the other group of monkeys, none of them were gray, they were sharp, they didn't have any arthritis, and they didn't have any diabetes. And all that they did differently was eat 25% less calories.
The less that you eat in general, the better your joints are going to feel. Now, most Americans know that the trans fatty acids are bad for you, that they predispose to heart disease. Most people don't realize that trans fatty acids will increase the overall body inflammation and sensitize the nervous system.
If the person is eating essentially what we know as the standard American diet, full of flours, full of sugars, processed food and processed carbohydrates, the healing will be impaired.
In part, it's pulling out foods that you could be allergic to, because those antibodies from the allergy will contribute to the pain and inflammation. So it's a combination of pulling out the bad and putting in the good.
Remove things like cow's milk and dairy products and excessive amounts of red meat, especially conventionally raised meat. I think those things really increase inflammation in the body.
Red meat and animal products are all bad because the inflammatory markers in red meat, the free radicals from red meat, don't help you heal. They damage the healing process. So that's sort of a general thing, keeping animal meats and animal products out. Keeping chemicals out, you have to eat organically. Lots of organic vegetables. Juicing vegetables is always a great idea, because you're getting wonderful vitamins, minerals, combinations of substances that will bind to free radicals and also help to heal.
Juicing is very important to reverse arthritis because when we juice, we're concentrating the phytonutrients, the nutrients from the plant. We're extracting it from the pulp or the fiber of the plant and just getting those essential phytonutrients.
I cook a lot with organically grown onions, shiitake mushrooms, enokis, matakis. These mushrooms, medicinal mushrooms, are very healthy for you. Organically grown leeks, organic baby bok choy. And then you put in the anti-inflammatory herbs, the turmeric, the ginger, the garlic, cardamom, cinnamon, whatever you like. I love curries, incredibly healthy.
Some fish, like sardines and trout, have very high levels of omega-3s. Omega-3 fatty acids are very highly anti-inflammatory. And if people don't want to have fish, they can have flax oil.
Healthy oils bring down the inflammation in our bodies by lowering our body's ability to over-inflame. So things like fish oils are great, so eating fish, good, wild-caught salmon, things that come from clean waters, hopefully not laden with a lot of PCBs and a lot of mercury. So good, healthy oils. Olive oil, I think, is very, very important. I recommend people buy organic, extra virgin types, glass bottles, small quantities, because you want those oils to be very fresh and very, very clean.
You have to have a little omega-6, you have to have a little omega-3. Most people have way too much omega-6. And so I will tend to listen to what they're eating, take a food history, and then try to get them to a point where they're kind of balanced. Natural sources of the omega-3s, trying to cut back on the processed oils and the things that contain a lot of omega-6.
We want to have whole life foods, and especially foods that are high in folic acid, things like lentils and barley and split peas. So think of things like grains and beans and nuts and seeds. Green leafy vegetables, very important. The green vegetables are really what detoxify the body. They help to pull heavy metals out. They alkalize the body.
Basically, dark greens have so many of the nutrients that our bodies need to heal, that our bodies need to fix things. The natural world provides pretty much everything we need for our body to repair and fix things, but we have to take them in.
Multicolor vegetables eaten in a raw state, let's say the green of lettuce and spinach and arugula, the red from tomatoes and red peppers, the orange from carrots, and so forth. When we do like a multicolor salad, it provides polyphenols, that is, phytochemicals that have a beneficial effect in any healing process in our body. When we combine that with a variety of fresh, raw, if possible organic fruits, we're also providing antioxidant and phytochemicals that participate actively in the healing of the arthritis in this case.
The red chlorophylls, the red phytonutrients, actually heal damaged cells. And when you have arthritis, you have a lot of cellular damage. So when we have berries, you're now giving your body an opportunity to heal itself. Two foods that help to combat arthritis are papaya and pineapple. They both contain enzymes that actually turn off the inflammatory response.
Besides the foods, then we start talking about chewing our foods and kind of relaxing and taking a breath, so this way our digestive enzymes get going so they break down. Sometimes even if we eat the healthiest foods, if our digestion isn't relaxed and it's not working well, it won't break down well, and that'll create inflammation in our lower digestive tract, which will turn into joint inflammation.
Inflammation is probably one of the most destructive things in our body. And over time, we have more inflammatory substances, which we call reactive oxygen species, or free radicals. So we can do antioxidants, like vitamin E, or CoQ10, or even vitamin C.
Vitamin C is a major component of collagen. So you want to have a lot of vitamin C on board, because that will help to set some of this cartilage structure and framework to enhance your healing process.
And we encourage people to take vitamin C with quercetin. Quercetin is not only anti-inflammatory, but it helps to bring the vitamin C into the tissues.
If a person has active pain, there are certain herbs and anti-inflammatory nutraceuticals which are wonderful. Things like fish oil, I think, is a very gentle anti-inflammatory. Devil's claw, cat's claw, boswellia, curcumin, I think, is wonderful, which is turmeric, widely used in Indian medicine and Indian cooking.
Turmeric, particularly activated turmeric, and if you're going to cook with it, make sure you cook with black pepper, because it's the piperin that's released from black pepper that activates the anti-inflammatory compounds in turmeric, the curcuminoids. And these are the compounds that work in a natural way, just like ibuprofen.
Biopurine is a substance from pepper, and it works very well with curcumin, almost synergistically.
And then there's a lot of things that I think are supportive to structure to help cartilage and connective tissue regroup and repair. So things like glucosamine, sulfur-donating compounds like MSM, things like magnesium I think is very important, and boron and vanadium and calcium. And I like using silica, which comes from the herb horsetail. I think can be very helpful in the repair process.
We've seen some papers that have been very positive for glucosamine and chondroitin at 1,500 milligrams and 1,200 milligrams of chondroitin.
Ginger at 50 milligrams, highly anti-inflammatory. Finally, we add black currant oil. So when you put all of these supplements together, you're giving the body everything it needs to shut off inflammation and therefore shut off the pain.
To prevent arthritis, I think exercise and body movement and joint movement is critical. If a person isn't moving their body, it's much more easier to degenerate because you're not moving nutrients, you're not getting circulation to an area, so it's going to more easily break down.
By trying to keep the patient in motion with physical therapy, aquatic and pool work, walking program, self-stretching, these are foundational.
Particularly as we get older, because we lose muscle mass. And there's a treatment for that. The treatment is exercise. You can stay healthy and vibrant by doing resistance exercise. And you can stay with enough energy by doing endurance exercise.
If you can get somebody out walking, get them into a nice warm pool doing aquatic therapy, get them onto a cross-training machine, get their heart rate up, a lot of things change. Your neural hormones change. Your immune system normalizes. Your pain pathways quiet down. People feel better in motion.
The exercises that we teach focus on relaxing, limbering. Limbering is movement in the range of comfort, then stretching. Many people, when they go out to do their exercise, go immediately to stretch. No good. You have to relax and limber before you stretch, because then you're stretching stiff, tense muscles. So you never get a complete stretch. Once you're stretched out, then you can strengthen. Why? Because if I strengthen a stiff muscle, I make it stiffer. So those of you who are just going out and immediately going to the weights and immediately going to resistance training are potentially damaging yourself.
Swimming is an excellent exercise for those with arthritis. You're in a weightless environment, you're getting great range of motion.
People who do swimming tend to find their joints typically feel better. I think the cold is kind of calming to an inflamed joint, and the movement brings the circulation to the area at the same time, so it's perfect.
Other types of exercise include things like yoga, or Tai Chi, or Qigong. Also includes great range of motion. You're working the muscles, you're working the breath. It's just an ideal way to get your exercise in.
If you do regular exercise, if you stay trim, if you pay attention to your appearance, it's all part of healthy living. I mean, it's not like that's for the young folk, that's for everybody. Why shouldn't you be your best always?
Most of us are so stressed out. We personalize things that happen to us, and we need to take that time to just pull back and relax.
Looking into sleep is critical to treating a chronic pain patient. First of all, it's important to all of us. The basic research shows that we should all get about 7 to 8 hours a night. People who get a lot less or get a lot more have a lot more illnesses. You need to get enough sleep.
There's a major problem with sleep deprivation in the United States. We have become so overloaded with information and distraction and disconnection from nature. We don't tune in to what our body is asking of us, which is a time to sleep. And you can easily get into a pattern where you believe that 6 hours is all you need.
In Chinese medicine, an hour before midnight is worth 2 hours after midnight. So to translate that to this situation, when the time we go to bed is very important for our healing and our repair processes, and also for detoxification as well. So the later we go to bed, the less we're really allowing our body the process of repair and regeneration and healing.
Pain is a very complicated phenomenon because it's not just the function of what's going on in the joint, it's also a function of how you interpret the sensation. When we see patients who are suffering for long periods of time with pain, and we see a lot of impairment, that they can't do the usual things that they used to do, invariably we see elements of this sense of that this is a punishment for something I've done in my life, somehow I deserve this, or it's beyond my ability to withstand this, it's impossible. Those things, which aren't true, obviously, need to be delivered back to the patient in a way that they can understand that they're distorting the experience in a way that's self-defeating and self-damaging.
The relationship between how you feel, how stressed out you are, how upset you are, and your physical health is obvious. And it is obvious in science now, too. It's not the stress that kills you, it's your reaction to it. And I think what this opens the door to is the whole field of the mind-body therapies.
What I encourage people to do is to not personalize, not lose their identity to their disease. The disease is just the body giving you information, and it's screaming for your attention. So what you don't want to do is lose your whole identity to a bunch of symptoms.
Someone who's been trained to do meditation, mindfulness meditation, for just 4 days can reduce the overall experimental pain sensation in the laboratory by 57%. There's no drug that I prescribe that is anywhere near as powerful, physiologically, neurologically, as meditation. So there are these active ways using these ancient meditation techniques that have been shown in really elegant, robust science to block the pain signals, to block them from actually getting to the part of your brain where you feel them. They get blocked down here. They don't even show up where you feel them. So it's not a matter of being distracted. It's a matter of quieting the neural pathways, quieting these pathways, and the pain just dissolves on the way to the brain.
Mindfulness meditation has been extensively studied and is effective, and it can be very useful, and it can diminish the suffering that one experiences in relationship to arthritic problems.
How do you sustain good habits? How do you really keep them up? We're all human. And to err is human. And I know that people, we all have, including myself, have resistance to doing what's good for us. It just seems to be human nature. It takes commitment and desire and knowing what your why is. So people may say, well, I want to be alive for my kids. So I'll say to them, well, remember that. Remember that when you're about to reach for that candy bar. Remember that when you want to have the entire plate of pasta or the entire plate of ice cream, because that brings you back to why you want to be healthy.
The first great textbook in Chinese medicine, the Neijing, which was published around 100 BC, the Yellow Emperor, who wrote the Yellow Emperor's Canon of Internal Medicine, said the first doctor is the patient. Because ultimately, if you're not going to go to PT to work on your pain and arthritis problem, it's not going to make a really huge difference to me. I want you to do that, but if you don't do it, it's not going to change my life that much. If you want to eat ice cream and chips all night and get all inflamed, it's not going to affect my diet. And that's why I really have to ask you to engage as the other doctor in the room from the Chinese medicine standpoint, as being part of this team to get you better.
Perhaps the most important barrier that I have with every single patient is to convince them that, yes, they have to assume a more active attitude in their healing. Understand the process that is causing the arthritis, read about it, and learn what you can do in regards to your nutrition and your activities and the supplements that you take to heal that joint.
What I typically recommend is once my patients are on what seems to be a healthful path, and they're doing quite well, and maybe they're 75% or even 100% better, is I like to have them come in from time to time and check in. I'm sort of now they're the place where they go to be accountable for their life and their lifestyle, not in a judgmental way, of course, but in a helpful way, a way where I could, check in and say, how's that water intake? Are you still drinking that big glass of water in the morning and taking your water bottle to work and keeping it on your desk and drinking it? How's the exercise schedule? If it's falling off, what are the challenges? How can we get some of that back? What you've been eating. There's an old saying, everything in moderation, including moderation. So if occasionally people drop off and don't follow it, it's okay, as long as for the most part they're taking care of themselves in their everyday life. And I think really the key is follow-up.
Well, we try to teach people how to focus on a goal. A goal-oriented process makes a great deal of sense, and as you step up on the ladder, you're getting to higher rungs and you're getting to better places. So I'd like to get into the mind of the patient and say, if you've never done this sort of thing before, you have to write down what your goal is. And every week you want to say, well, I'm going to walk a little bit further every week. And as you write it down and you see your benefit, it's rewarding, it's reinforcing for you. As we put you on a nutrient plan and you feel better and you're more energetic, I want you to write down, oh, I feel this percentage better, 50%, 80% better this week. And I'm better this week than I was last week. If you write all this down and you see this visually on a piece of paper or in your journal, you'll be able to understand where you're going and what you've achieved. And that is very reinforcing to keep you doing it.
Be around supportive people. Find like-minded people who are going to help you on your journey. Keep yourself well educated. There are things on the internet. There are wonderful documentaries out there. Fill your mind with these things. Really, success is about the study of where you're putting your attention and how easily you manage distractions. And finally, it's about developing the art of self-love. Understand that you deserve to be healthy. You deserve to be pain-free. You deserve to be happy.
So if I'm going to be one of that growing group of elderly citizens who live to 100 or more, there are three factors. So aside from what we're talking about in terms of food and diet and exercise, is one, a passion for something in life. Two is the ability to deal with loss. That we've got to recognize that everything in life is going to change. We're going to lose loved ones, and we're going to lose certain function in our bodies, and just the acceptance of that. And the third, and very importantly, is a sense of humor. That if you can't see the silliness of things that bother us in life, it's going to really get you down. And when it does, it creates bad chemicals in your body. And if we can pay attention to diet, exercise, passion, integrity, sense of humor, and accepting life on life's terms, got a much better shot at having a good life.
So here's the complete arthritis protocol. You start out with a healthy diet with filtered water, foods high in folic acid like lentils, split peas, barley, soy, oats, an organic vegetarian diet with garlic and onions, salads, beans, nuts, seeds, green leafy vegetables, deep water fish like salmon or sardines, flaxseed or fish oil 3 times a day, at least 1 teaspoon of coconut oil daily, either in smoothies or with cooking, avocados, olive oils and or olives, tempeh, tofu, seaweeds. Juicing, and that includes celery, cucumber, apple juice, pure grape juice, either blue, black, or red, 4 glasses of vegetable juices daily, at least 1 glass of berry juice a day, cabbage juice, dandelion, parsley, alfalfa juices, lemon, lime, and aloe juice. You can even add things like a capsule of cayenne or wasabi mustard in a juice. Herbs include alfalfa, angelica, boswellia, dandelion, cat's claw, and devil's claw. Supplementation is the omega-3 fatty acids twice a day, curcumin, N-acetylglucosamine, ginger, vitamin C in divided doses up to 3,000 milligrams, chondroitin sulfate 1,200 milligrams, MSM 500 milligrams, bromelain 500 milligrams, black currant oil 1 teaspoon, and blend up 2 pineapple cores per day. Then we look at the other essential lifestyle changes, and that includes exercise, daily meditation and relaxation, essential sleep-rest patterns, paying attention to environmental and personal hygiene, removing mercury amalgams with a holistic dentist, doing your emotional work via journaling or even counseling. Also, you can integrate additional therapies like acupuncture, Chinese herbs, hot Epsom salt baths or saunas, massage therapy, reconstructive therapy, otherwise known as prolotherapy, physical therapy, and things like yoga, tai chi, and qigong.
In the last 4 weeks, everything has really changed. My swelling has gone down. I almost feel normal again.
The pain level has gone down about, I'd say, 50 to 70%.
I wasn't able to stand more than 5 minutes without my knees buckling. And now, 4 weeks later, my pain is about 50% less.
The decrease in pain is phenomenal.
This hand right here, I actually literally was not able to make a fist over 4 weeks ago without having difficulties with my fingers.
My goal for the last 33 years since I started to suffer the ill effects of arthritis is to be able to look over my right shoulder. I'm able to do this without swinging my whole body.
In 6 days on this protocol, you see me standing here now, I'm shaking a little bit. I couldn't do this last week. In 6 days, it's been amazing. And I appreciate it.
We can't do compartmentalized medicine. It's got to be the whole person. And in a way, we've got to go back to where we used to be, to our roots of really treating the whole person. And sometimes high technology hasn't really resulted in better care. If you look at the cost of neck and back pain, for example, from 1997 to 2005, it went up from $52 billion to $86 billion. A 64% increase. In that same period of time, the number of people reporting being disabled from neck and back pain rose by 25%. We spent $34 billion more, and 25% more people are disabled. We're doing something wrong.
The Institute of Medicine, the most august of our evaluating academic bodies, says it's 116 million Americans. That's more than 1 in 3 Americans live in chronic pain. Pain disables more people in the United States than cancer, heart disease, and diabetes put together. The amount of money that is lost from the American economy due to this chronic pain problem is roughly on par with our national defense budget.
There are close to 400,000 knee and hip replacements in the United States each year. There's close to 400,000 back surgeries in the US per year. Now, many of these are life-saving for the patient, and a lot of them are unnecessary. And if it's unnecessary, that's at a huge cost and probably unnecessary suffering. So we have a wonderful contribution from modern medicine that sometimes is misused.
The way things are in conventional nowadays, with a person going over and over to orthopedics and specialists and taking pills, that person has no future because with those remedies, the joint does not heal. Actually, slowly it gets worse. Alternative medicine, or if we want to call it integrative medicine, which is the combination of alternative medicine and conventional medicine, offers the individuals affected by joint ailments, offers a future, offers improvement, offers healing, offers a decline in the pain, offers an improvement on the function, offers a better future.
The biggest problem in terms of pain is arthritis. And we know it's unavoidable, and we know that we can address it with non-drug approaches non-surgical approaches, and that has to be our number one priority. If we don't do that, the system is unsustainable. And one of the reasons it's unsustainable is because we treat the wrong things. If we just segue to back pain, if you took 100 people off the street, 40% could have herniated discs with no pain. 70% could have degenerated discs with no pain. The number one diagnosis for back pain is called nonspecific low back pain, meaning sprains and strains of soft tissue. But if I don't think about that and I get an MRI or an X-ray, I'll find another diagnosis that I can treat easily but not successfully because it's the wrong diagnosis, because it should have been soft tissue that I was looking at. Arthritis, it may have been depression I should have been looking at. People who are suffering can easily fall into a trap of hopelessness. And I think that becomes the biggest enemy, the loss of hope, and the feeling that nothing can be done to make it better. And that's not true. That's a lie that's in your head. No matter what situation you're in, you can always make it better. And just by whoever's watching this show right now, they're in touch with a part of them that wants to make it better. Go with that part of you, because it's true. You can make it better.